Well, imagine having a disease for years, even decades, and being completely unaware. Hepatitis C affects more than 3 million people, many of them baby boomers. And this week, there's some special attention on testing for this often silent disease. Dr. Imtiaz Alam and former HCV patient Denise Curtis are here to explain more. Good morning to both of you.
Good morning.
Good morning.
Dr. Alam, I want to start with you. What are some of the risk factors for hepatitis C?
So the major issue in terms of risk factors is that about 85% of people with hepatitis C are born between 1945 and 1965. So what we're recommending is that if you're born in that age group, talk to your doctor and go and get a simple blood test to see if you have hepatitis C. Unfortunately, most people with hepatitis C don't have any symptoms, and sometimes it's too late and they go on to develop significant damage to the liver, including liver failure and liver cancer. So it's important to go and get testing done if you're born between 1945 and 1965.
Are those the only risk factors, just being born between that period of time?
So the major risk factors, what they found is that 85% of people with chronic hepatitis C are in that age group. And the risk factors include if you've had a prior history of taking drugs intravenously, sharing needles, if you've had previous tattooing, or if you've had a simple blood transfusion before 1992, you're at an increased risk of acquiring hepatitis C infection.
Gotcha. Denise, I want to get to you for a second here. How did you find out you had HCV? And I guess especially you think testing is really important.
It is important. That's the only way you're going to find out is if you have Hep C. I had given birth to my first child, went to go get life insurance, and they did some testing to see if I was insurable, and it was through them. They told me that there was a problem, go see my doctor. So I went to go see the doctor, and it was then that I told that I had hepatitis C. So it's been 30 years. I have done the old treatments. I did them twice. I did it in 2005. I did it in 2007. Both unsuccessul. So I was very reluctant to even inquire or follow up on Hep C treatment. But I did by the suggestion of my primary care physician. Went and saw a specialist, learned that there's a pill a day. I'm cured. I no longer have to worry. I don't have that dark cloud hanging over me all the time. I don't have to worry that this is going to take my life, that it's going to continue to do any more liver damage.
Yeah.
A lot of people have a lot of questions. Go out and get tested. It's too easy not to.
Yeah,
way too easy.
Sure, and the peace of mind, if anything. Doctor, what are some of the symptoms of
Sure.
HCV? I know that a lot of people don't see those symptoms, but there are symptoms that they should be on the lookout for.
Sure, most people with hepatitis C have no symptoms at all. That's why it's called a silent epidemic. The common symptoms that you may have could be something as simple as having fatigue, joint pain. And sometimes if it goes too far along in the disease process, some people, as I said before, can develop scarring in their liver that can proceed to developing liver failure or liver cancer. So that's why it's so imperative to talk to a doctor, talk to a specialist, and get on treatment. And as Denise has said, the treatment can be as simple now as taking one pill a day. And by taking that pill, you have over 90% chance of being cured. And once you're cured, most of my patients say they feel so much better. As Denise said, the symptoms do go away, and you can lead a potentially much healthier life.
Yeah. Denise, what do you want people to know about HCV? And I guess any advice for them? Because you learned a lot about this disease as you went through this process over the last few decades.
Oh yeah, absolutely. My advice is don't do what I did and put it off. Following up with another doctor with the new treatments, get tested. Go and talk to your doctor. The treatment is too easy. There's a better, brighter tomorrow. You don't have to live with Hep C. You don't have to be a victim. You don't have to be a number. You can be cured.
Yeah.
I got cured.
Great
Go.
point. Great point.
Go.
Denise, thanks for your time. Doctor, thanks for your time as well.
Thank
you.
You betcha.
Thank
Have a
you
good
very
day.
much.